if you break down my research agenda, it really boils down into two broad areas, right? So one is improving the delivery of healthcare, and the other is improving the context within which healthcare is delivered. I'll talk a little bit about the delivery of healthcare first, and then I'll talk a little bit about why shaping health matters, right? When we started the Army study on transforming when we changed the delivery of behavioral healthcare in the Army from an organized anarchy to a system of care, that highlighted some of the standard challenges that you have with any healthcare delivery system, right? Number one, how do you organize care? How do you know that the care you've organized is actually effective? And last but not least, how do you combine this real wealth of data that you have to actually support meaningful decision making? So that idea of understanding what happens on the ground, that's field research. Understanding the data, the vast volumes of data the Department of Defense collects, that's your healthcare analytics component of it. And then the doing of the change, which is participatory action. One of the challenges with health systems is, how do you know what's the right intervention? Right? So if you're trying to make an intervention and you have to actually pilot it, in some cases you can't pilot it without disrupting care. That's where modeling and simulation comes in. So how do we build models that enable better decision making without negatively affecting patient care, so we can make better decisions, right? So that's really that first stream of improving healthcare delivery. What we learned from the Army study was it doesn't matter if you're delivering world-class healthcare if you can't get people into care, right? So the shift to health, I think there was a modeling study that came out of Wisconsin, I believe, where they talked about the fact that only 20% of health outcomes are driven by the actual healthcare encounter. There's no place that's particularly more, where it shows up more than when you think about in the Army, right? How do we get leaders to identify that there are healthcare issues going on with their soldiers and their families? And how do you get them into care? And that's really that second research thrust that we're focusing on now, is understanding how leaders do sense making and sense giving to promote health vice healthcare. There are a couple of implications from the research itself, right? So one is you have to define a system of care. One of the largest challenges you see is we've treated healthcare as a series of discrete events, but it's not. Healthcare is the delivery of care is a continuum that you span across multiple segments of that care delivery system. So as you transition, you need to know what are the clinical microsystems, how do you transition across those clinical microsystems, and what's the underlying data set that shows you that. Because it's not always going to, okay, I had the luxury and the support and the research support, so I could actually walk care delivery, right? So we've seen how care is delivered in the Army. So when you go to one hospital to the other and they say, hey, we're different, you can make the argument that you're not. It's not always going to be possible to have that kind of in-depth field work. So that's where the data has to reflect it. So the argument that Chris Ivany, Dennis Sarmiento, John Woodson, and I make in our HBR piece is you have to be able to define what that underlying system of care looks like, and then make sure that the data matches that system of care. So your accounting infrastructure supports that. So when you have a standard system of care, you can actually start inspecting how patients flow through. That's the real implication. From a practice standpoint, do you have a defined system of care? Do your accounting systems support that system of care? Can you actually extract data and analyze it and support leader decision making? In the end, the people that make the decisions on healthcare are both the patient and the administrator. We often forget that the people running the health system have a very, very strong say in the patient experience of care. So can we give them better data so they can make better decisions? There is a richness to healthcare. So in research, we talk about the thickness of a description, right? So putting students in places where they can see the practice, so they're not necessarily looking at the theory itself. Because it's one thing to define what a performance of a Q is, right? And mathematically show what the notation is and say, hey, here's how you analyze Q performance. It's another thing altogether to have them sit in a waiting room and observe the impact of wait times, right? It's that very, very simple translation of concepts to practice that is really, really important, right? The Institute is unique. It allows us to bring together actors from the School of Business, School of Public Health. So the course I teach in healthcare, in operations management and healthcare, we have teams of public health students that are partnering with second-year internal medicine residents who are also partnering with MBA students, all working together to improve care delivery in an actual healthcare delivery setting. So that's the ability to take the research, which is, hey, here's all these good ideas and all the data analytics that tells us what the right thing is, and actually applying it in practice. So one is John Woodson. It sounds, one of the primary reasons for coming to the Institute for Health Systems Innovation and Policy was Dr. John Woodson. I'd had the privilege of, John had funded a lot of our work, and he had seen the need for the kind of research we were doing. And when he came back to BU and started the Institute with you, the point that he made was there are very valuable lessons learned from the Department of Defense that can be translated to the civilian sector. Equally importantly, there's a lot of lessons learned from the civilian sector that can go back to the Department of Defense. So the idea of, we had piloted this model of the Army as a laboratory in the work at MIT. Could we replicate that and not just look at the Army alone, but look at other large health systems like Boston Medical Center? And the opportunity to work at Boston Medical Center is one of the primary reasons I moved, right? We serve a very unique population. We're a safety net hospital. So we take care of the vulnerable, the poor. And what it creates is, I studied a healthcare system in the Army where the health benefit is guaranteed, right? So there are certain very unique challenges when somebody accesses a healthcare service, a healthcare system where the benefit is guaranteed versus when they're accessing care at Boston Medical, where not all of them have a guaranteed benefit, right? So there's some really interesting organizational problems of how do you design care when you have this very mixed beneficiary population set. There's challenges with respect to improving quality of care when the payers are so different. And the fact that BMC is going to be one of the largest accountable care organizations in Boston means they have to really implement value-based care in ways that have never been implemented before. So we get to study the success or lack thereof over time. I think that's really exciting from a research standpoint. I think there's something unique about the Institute, right? Everybody has made the argument, everybody recognizes that healthcare is complex, healthcare is challenging, healthcare cannot be a single stakeholder solution. Yet a majority of our research is single discipline focused. Right? What the Institute provides is an opportunity for us to truly multidisciplinary, interdisciplinary work that is focused on addressing the hard problems of healthcare delivery. How do we improve access? How do we measure quality? How do we transition from providing health care as a service to managing health as a service? And that transition, I think, is something everybody is struggling with. And we have an opportunity from a research and practice point to impact that. That, I think, is important.